to assume such as that Del Mar and Butler site. The reason that it's important for us to keep those sites going is because in the last couple of weeks you see that we have maxed out every day. I get a text at about 10:30 in the mornings stating that our gates are closed, which means that we have registered enough people to fulfill the capacity at each one of those sites. We're hopeful that the state will be supportive of redirecting some of those resources to give us an opportunity to actually transition into another mode so that we can keep those major sites going.
The numbers are increasing. 987 today from the 14th through the 21st, 22nd. But on average, we are looking at more than 650 cases per day, okay, on average. Today was 987, I think yesterday might have been 844, the day before was 1,789, Saturday was 844, on Friday was over 900. I can the numbers kind of stick within my head. Look, people wanted to open up towards the end of April, May, and we did. And people wanted to get out and about, and now people are re-socializing. And this virus now is taking off. Nobody's saying we're shutting down, but we are asking people, you want to open? Okay, let's put on the mask. You want to kind of get out and about? Let's put on the mask. You can still social distance. So we're going to be monitoring things a lot closer as we move towards the weekend. And quite frankly, because this is a healthcare crisis, I don't care if you get mad with me, but we are going to get this thing under control, okay? We are going to get this thing back under control. And so certainly encouraging people to do their part and let's step up as Houstonians do, and at the very minimum, okay, put on the mask, engage in social distancing, wash your hands, and if we get on top of it now, I think 2-3 weeks down the road, hopefully the numbers will be reflective of it.
Del Mar will be open after June 30th?
Yes.
How important are those two sites when you're looking at the whole scheme of the city's testing?
There are over 60,000 people have been tested, and they are maxing out before noon every single day now. So they are hugely important. Now, you know, we would love for FEMA to continue providing the resources and supporting those two sites, but if not, then the responsibility will fall on the city working in conjunction with the Texas Department of Emergency Management.
How much of a strain will that be on city resources?
Mobile sites, testing sites in their respective districts all over the city, and so the more we have to put into maintaining.
Assistant Surgeon General used a phrase, catastrophic cascading consequences, to describe the impact that you said losing this federal support will have. Can you tell us just how big a deal this is?
Yeah, particularly hospitalization. And so the key thing when I use those terms is my fear, if we get to the point where the hospitals are overwhelmed, and we're not there yet, which means we have time, right? So we're not there yet, and the hospitals, we're in touch with them every day, and they are really doing some pretty creative things to create more capacity and to manage the load. But if we should get to the point where it exceeds what they can do, you know, my fear, and as an emergency physician, as you can probably imagine, is comparatively a more uncontrolled environment than the intensive care unit. And patients ultimately get better care around diversion, or the emergency departments are saturated over the ICU patients, that there's a good chance that as well.
So as it relates to the...
We're gonna figure out where we're gonna sustain. Stephen's already got a plan. He probably will let
The issue of funding. If you look at the sites, Del Mar and Butler partners, for example, the Health and Human Services staff will be checking people in. Currently, we have the